Thank you, Clive, and thank you, Cabinet Secretary, for your statement today. As a recent father, it is extremely worrying to read about what families have been enduring in order to access maternity and neonatal services at Swansea Bay University Health Board. And I'm glad to hear from your statement of the actions that have been taken, the improvements that have been seen, and your recognition that more work is still needed to be done to improve patient care. However, what is immediately noticeable from the Clyce report is that a lot of issues come from staff seemingly following procedure, but then completely discounting the empathetic human element that comes with caring. For instance, the report states that many were made to feel like they were overreacting, imagining things, or not to be trusted about what was happening to their own bodies, which left them feeling confused and undermined. Such actions included being questioned as to why they needed pain relief immediately after stitches. Cabinet Secretary, again, I speak from a personal perspective as a first-time parent. The whole experience can be quite overwhelming, and I wasn't the one giving birth. I am sure that nurses have a requirement not to just dish out painkillers, but to ascertain from the patient why they believe painkillers are needed to try and describe the pain. But clearly this isn't being done in the most empathetic manner, especially if patients are saying that the questioning felt unwarranted or derogatory. This sense of being dismissed is a common theme across various healthcare areas, including endometriosis, menopause, and urogynecological conditions that we have had countless debates in here on the state of women's healthcare and the disparities that they face. I'm concerned that this report again adds to this disparity, and I'm keen to know if you do too. The fact that there was agreement across all the focus groups that women felt that they were shown disrespect through the use of clinical terms and attitudes expressed towards them is, I believe, part of a much wider issue that warrants more investigation by the Welsh Government. What improvements do you think could be made to help mothers and fathers, particularly first-time parents, understand the experiences that they're to expect and the types of questions that they're going to face? One of the lessons of my family learned was the importance of brain, benefits, risk, alternatives, intuition, and nothing. But I'm conscious that this came about as a result of attending a maternity class, and I would be keen to know, Cabinet Secretary, how widespread this policy is within the other health boards. Some parents go through a lot of anxiety and stress during the pregnancy, and I believe that improving communication early on is a key part of reducing that. Do you think that there is scope to better prepare parents during the pregnancy stages? In healthcare today, much of the work is driven by the need to fit neatly into clinical pathways. Medical professionals don't really have the scope to describe clinical situations without the use of clinical terms. They're limited in their use of non-medical terms because it can open them up to malpractice lawsuits because of subjectivity of interpretation. They have to be able to record and evidence what they've told patients about their condition. And they do this because when something goes wrong and their practice and discussions fall under scrutiny of the medicological microscope, expert witnesses refer to best practice guidelines to assess their actions, and criticisms are made if professionals veer off from following procedure. This is not an easy situation to resolve, and I imagine the medical staff are themselves quite frustrated. Therefore, Cabinet Secretary, what do you think can be done about this? I would not be surprised if measured this was the type of issues found in a lot of clinical settings. Two of the most distressing parts of this report is that there were unsafe environments in which women were given birth, which amounts to negligence by staff, senior staff, and those responsible. The second was that mental health provision was found to be inconsistent. I find it particularly concerning that there were failures in recognising and treating infections, degrading treatment, and potential neglect in postnatal care, and that some people were denied access to mental health support due to delays referring them onto the right service. The startling fact, Cabinet Secretary, is that some people were not offered support even after experiencing a stillbirth. I cannot imagine what they must have been going through. I recognise in the report that the Health Board has addressed these specific issues, but what guarantees can you give as Cabinet Secretary that they will ultimately be implemented effectively? As you all know, the Clyce report doesn't mention the actions that were taken against staff to hold them accountable. We cannot have a system that allows for staff to remain in post who have failed in their duties to make a safe environment and have mental health care available. I can accept the argument that it is a lack of training or that more training is needed, because this is not the case in other health board and other health maternity board units whose staff would have access to the same training. Cabinet Secretary, what action have you taken to review the staff responsible for making the maternity units safe and providing access to mental health care? Finally, evidence has shown that the continuous media portrayal of an NHS in crisis is shaping negative public perception and is making patients feel that they must manage their own care to avoid being overlooked. As a result, many patients seek out health-related information before their appointments, which can unintentionally set the stage for confrontational or expectation-laden consultations, where they identify that they are not being listened to. Clinicians have also expressed concern that they are increasingly portrayed as villains who are not working in the best interests of the patients, and this complicates their ability to provide care and can create barriers between them and the patients before treatment even begins. With this in mind, Cabinet Secretary, what action is the Welsh Government taking to improve patient confidence in the advice and care that they are receiving, especially from medical staff at the Maternity and Neonatal unit in question? Thank you.